This is Dr. Tanvi Gaba. I'm a gynecologist. I'm a laparoscopic surgeon. I practice at Akash Med Square, Akash Hospital, and PSRI Hospital in South Delhi. I've been practicing for a lot of years, and I've seen a lot of issues young patients have been coming up with lately. It has gone up a lot, actually, the infertility problems or the fertility issues that young people are having nowadays. And it's going up for various reasons. And I think we all know why, but I will be elaborating that in my presentation. But since the fertility issues are coming up, so we need to be more aware about what are the what path should we take while we are planning pregnancy, and what are the do's and don'ts of planning a pregnancy. So let's talk about that. Let's start that presentation now. Can we move to the next slide, please? So firstly, for starters, let me ask, when was your last health checkup done? If you guys could just poll, or if you guys could just vote, so we'll get an idea about how aware are you guys, and how actually how much importance you give to your health, which we know we ignore our health quite a lot, actually, especially the younger generation. uh, 18 plus 13. Okay, so roughly 42% got it within 6 months, within last 6 months. 32%, it's been more than 6 months that they went to a hospital or they got a health checkup done. And almost 26%, which is also a very huge percentage, and they got the health checkup done more than a year, or more than a year ago. So see, that does show us that we don't concentrate on our health, or we don't give attention to our health very well, and we need to be more aware and more present about maintaining our health and getting a health checkup done regularly. Can we move to the next poll, please? So, have you visited your doctor for preconception counseling ever? It can be about contraception counseling also. If you're actually not planning a pregnancy, even that comes under this only. Are you taking contraceptive pills, or are you practicing any method of contraception after discussing with your gynecologist? Then I would like to know that. Okay, so roughly 69% of the people have never visited a doctor for preconception counseling, and almost 31% have. That's that's fair enough. Let's move to the third question. Have you been trying for more than 6 months for pregnancy? It's almost 50-50. It is 50-50%. So there are 50% people who are trying for less than 6 months, and there are 50% people who are trying for more than 6 months for conceiving. Understood. Can we move back to the slide, please? So, see, what happens is, we firstly, in today's busy life, especially in the metropolitan cities, we really don't have time or energy levels to actually look after our health too much. Plus, we are looking after older people also. We are looking after everything else around us. We are managing our lives alone. Most of them are single families. So you have to be more present. You have to understand that if you're not concentrating on your health, if you're not actually paying attention to the simple signs that your body gives you, the subtle signs that your body gives you, that you're not going on the right path towards a proper health or proper your body is giving you signs, then you should listen to it. Firstly, you should visit a doctor at least once in 6 months, or whenever you have any issue or anything abnormal that you notice in your body, you should definitely visit a doctor. You should also uh, firstly, then you have to think about your health. Then you have to think if you're specifically trying to conceive, there are too many things that you have to pay attention to. There are you have to get regular checkups done. You have to consult your gynecologist regarding what are the do's and don'ts of planning a baby, right? So that has to be done. And if you have not if you're one of those who's never taken any kind of counseling or any kind of consultation with a doctor as to how and when and what are the prerequisites of planning a pregnancy, then you should do. Whatever I can tell you, I will try to tell you in this presentation. If not, then please consult one after this presentation is over if you're amongst those people who have not consulted anyone for the longest time. So, can you guess how long does it take for a couple to conceive? So, see, it's not like a switch on switch off mechanism, right? It's not like a it's not like a switch that you just suddenly just have sex, although there are people who are lucky or unlucky, I don't know, that who actually have sex and just conceive immediately. And but not everyone does. It's very rare. It's almost just 20% of people who 20-25% of people who actually conceive in the first month of trying of pregnant trying to as soon as they have intercourse, the first month of trying only they actually conceive. It's a very smaller population. Can you move to the next slide, please? So roughly 20%, right? And for after 3 months of trying of having regular intercourse. And what do I mean by regular intercourse? That is the fertile period. If you're having intercourse in the fertile period of your cycle. So what is the fertile period of your cycle? That's between 10 to 21 day of your cycle. So by chance, if you get periods on the first day of every month or the second day of every month, so the 10th day, that means the 10th or 11th of that month to 21st of that month will be your fertile period. So those 11 days are your golden period to actually conceive. Why? Because the egg is released around the 14th day of the cycle. The egg is released from the ovary. And I'm sure you guys know exactly how pregnancy happens. So pregnancy, basically the sperm goes from the vagina, it goes into the uterus. So I can show you quickly. One second. So this is the uterus, right? So this is the uterus, this is the vagina, these are the tubes, and this is the ovary. So the egg is released from the ovary every month, alternate ovaries, 1 month this ovary, 1 month that ovary. So 1 month this ovary will release the egg, the fimbria, that is the tube, will pick up the egg and it will take it inside the tube. The sperm will go from the vagina, it will go up to the uterus, it will travel up till the tube, inside the tube, and that's where they meet. The sperm and the egg meet inside the tube, they fuse, the embryo starts becoming, and slowly it comes and gets deposited inside the uterus. Okay, so that is the normal process. So every month when the egg is released, it's not necessarily so when so the egg is released on the 14th day of the cycle, right? So when the egg is released, if you're having intercourse that time, there is a very high probability, there's a very high chance that you will actually get pregnant. If you're not having intercourse, if you're having intercourse in the first week of your cycle, just your periods got over, and if you're having sex that time, or if you're having sex in the 1 week before your periods are about to come, then there's a lesser probability that you'll get pregnant because the egg is probably not released or been released and um, um, wasted this thing. So it's probably so you have to have intercourse in the 10th to 21 days of your cycle, so you get pregnant. uh, 3 months into trying for pregnancy, there is only 50 to 60% of people who will get pregnant, who will get a positive UPT, because again, it's not an absolute this thing कि अच्छा आपने sex किया, आपने 14th day पे sex किया, 100% pregnancy हो जाएगी. No, it is nature after all, so we have to give that leeway to it. and it happens as and when, and it depends on a lot of factors. Were the egg released proper? Was the sperm able to reach the egg? Was the sperm motility enough? Was the egg quality good? Were they able to fuse? Were they able to fuse properly? So there are a lot of ifs and buts, a lot of steps that happens in before the pregnancy starts. So you have to respect that, and so that's why we say ki roughly 50 to 60% people will, into 3 months of trying, they will actually conceive. 70% of people, they take almost 6 months of trying to actually conceive, and 85% of the people will actually conceive within 1 year of trying. When do we say it's infertility? When after 1 year of trying properly within the fertile period every month, still if the couple is not getting pregnant, then we say it's infertility. So you have to try regularly for a year at least, and then only go for infertility testing. Also, do not jump into infertility or jump into that conclusion that you're infertile just in 3 to 6 months, because a lot of couples I am seeing nowadays, they're so restless for having a baby that they actually within 3 months or 2 3 months they'll just try and they say nahi ho raha, nahi ho raha, and they'll directly go to an IVF specialist and they'll get the IVF done. No, that's a very very wrong method. Unless you're like 38, 39, 40, if you're having a late pregnancy, then I understand. If you're a young couple, please give it at least a year of trying, then only go to an infertility specialist. So, again, as I mentioned just now, fertility does decline with age. So, you have to rush into infertility issues, or you have to infertility management only if you're an elderly person or an elderly couple. If you're a young couple, so if you're between 18 to 24, next slide, please. So if you're between 18 to 24, that's usually the highest fertile period of your life. So 18 to 24, your eggs are perfect, your sperm motility is perfect, the fusion is going to happen, everything is at best, the quality, the everything is good. So the 18 to 24 is the best age to get pregnant. But as we know, according to, because now everyone is earning, they're managing their lives on their own. Yeah, sorry. So 18 to 24 is a good time, very, very good time to conceive. But nowadays, no, hardly any people I've seen are getting pregnant between that age. So that's why the infertility issue is also increasing, because with age, the infertility, the quality of egg, the number of eggs. So a female is born with a fixed number of eggs in her ovary. With every cycle, one egg is released. With every menstrual cycle, most of the times, one egg is released. And so she, as and when she keeps on getting older and older, the number of eggs that are left are lesser and lesser. And also, the quality of egg keeps on decreasing. It could be the chemicals that we are exposed to, it could be the radiation that we are exposed to, it could be the lifestyle, the smoking, the alcohol, the vape nowadays, and everything, it's everything, the air that we are breathing, everything is impacting every cell in our body. So why will the eggs and the sperm not get affected? So definitely they also get affected, and anyway they're decreasing with age, the number is decreasing, so everything is working against us, right? So it is working against you having a baby at a later stage. So the best time is 18 to 24. Then from 25 to 30 is also a very pretty good time. It's not bad, but definitely you might take a little longer to get pregnant if everything else is well, but you will get pregnant in 25 to 30. Then 31 to 35, fertility definitely starts to decline. I have seen so many girls coming to me nowadays with premature menopause at the age of 30, 32, and it's a shock to me also. But um, imagine, because of whatever lifestyle and whatever things that we're exposed to on a daily basis, that is actually causing a female to achieve menopause and completely stop having periods at the age of 32. It's extremely premature menopause. So if she's at the verge of having menopause, obviously her eggs are finished, so forget about conceiving, you won't even get your periods. So you have to make sure that as soon as you cross 30, I will be telling you few tests that you have to do if you're planning a late conception. If you're planning a late pregnancy, then you have to get few tests done so that you know you have enough time left. If you don't, so you plan a pregnancy before, right? Then again, 36 to 40, the fertility declines a lot. Also, the problems like hypertension, diabetes, thyroid, during pregnancy. Even if you get pregnant, the complications will be too much. Also, the baby can have a lot of chromosomal abnormalities, genetic problems like Down syndrome, Edwards syndrome, Patau syndrome. There are too many of them that can happen. So it's risky for the mother, it's risky for the baby. So try to avoid very late pregnancy in life. 41 to 45, it's people do get pregnant. I'm not saying they don't, but the chances are very, very less. Then again, for men, the same thing: exposure to toxins, exposure to substances, exposure to radiation, exposure to chemicals. Uh, the with age, the quality of the sperm. So what is important in a sperm? Like the eggs, the number of eggs is important in a sperm. The quality of sperm, the movement of the sperm. This, as I told you, it has to go from vagina to the tube, so it has to travel a long distance. So the motility of the sperm is very important. So if it can swim that much or not, the sperm. So that is very important. So that also decreases with age. Then the semen volume, you must have noticed the semen becomes thinner and thinner as the age passes by of a male. So it must be thicker when they are younger. It becomes very thin when they're older, when they're above 35. So it does, you can see the changes yourself. Again, with an older sperm, with an older age person's sperm, the chromosomal problems, genetic problems will be higher, and the fertility rate will be much lesser. So, okay, so that I think I mentioned quite some time that quite a lot of times that factors such as diet, exercise, smoking, alcohol, exposure to environmental toxins can significantly affect fertility at any age. So, see, what are the factors that move to the next slide, please? See, so 7 important aspects of your preconception health. Anyway, any which way, for a healthy body or a healthy mind or everything, you need to do these few things. You need to, one is diet, very, very, very important. What we are putting in your mouth, what we are eating on a daily basis, what are the nutrition, what is the nutritional value of it, what are we eating too much junk food, are we taking a lot of alcohol, are we taking a lot of smoke inside. Everything that is going inside our body is impacting each and every cell of our body. It's not like ki khaya stool mein nikla and everything is over. No, it's impacting, it's getting absorbed, everything. So everything that you will put in your mouth will impact your eggs and sperms also. Secondly, so you need to understand if you're having a high carb diet, if you're having a lot of junk food, if you're drinking a lot of aerated drinks, if you're drinking a lot of alcohol every day, if you're eating a lot of red meat, if so it will cause insulin resistance, it might cause PCOD, it might cause obesity, it might cause diabetes, hypertension, a lot of things which will lead to problems, liver failures, which will definitely. So what happens is we release they all everything that we eat or smoke or drink, it releases oxidants, it releases free radicals in our body, and those free radicals are responsible for aging of the egg, of the sperm, of every cell of the body. So those free radicals are the killers. So so if you're not taking antioxidants, if you're not eating green vegetables, if you're not eating fruits, which are also chemical filled nowadays, so I don't even know what to prescribe my patients anymore. So I really don't know what is healthy, what is not. But if you can figure out, please eat healthy food. So that releases antioxidants, which actually kill the free radicals, which cause aging of everything in our body. Then again, the next thing that is very, very important is regular exercise. I cannot focus on emphasize on it more, but please, I have seen a vast major difference in people who exercise and who don't. Everything goes wrong if you don't exercise. exercise really alleviates a lot of problems. It avoids a lot of problems that might be coming your way. So extremely important. At least cardio, any kind of thing that you're doing, not just walking around, but any kind of thing, any kind of exercise that increases your heart rate to at least 130, 140, at least half an hour every day, because our body is meant to do physical labor. Our human body was always meant to do physical labor, but in the last, I think 30 or 40 odd years, we have just been sitting and doing everything. Everything is available to us, so we are not doing any physical exercise. We are ruining ourselves, our mind, our body, everything we are ruining. I don't think that's actually a positive development, but that's how way it is. That's how life it is now. So we have to concentrate on somehow doing physical labor every day. Then mental health. Mental health and stress management is also almost a similar thing, because again, I have seen so many of patients. It's unbelievable, and I actually have a smile while saying that, because I've seen it myself so many times, that a couple comes to me that they're not able to conceive. They're doing everything. She's paranoid as hell, and the guy is stressed out, and everyone is just so stressed in their family that they're not able to conceive. They're not able to conceive. She's living with that guilt that she's not able to provide a child to the family. She will never be able to conceive. A couple will not be able to conceive who is under a lot of stress. It could be personal stress, it could be emotional stress, it could be physical stress, it could be work stress, it could be any kind of stress. It could be anything that is bothering your head too much, and you're constantly thinking about it. While sex also, you're thinking कि अच्छा मुझे pregnant होना है, अच्छा ये काम करना था, अच्छा ये करना था. Nothing will help you, and the egg will not release, the sperm motility will decrease, the sperm quality will decrease, the sperm will not be released properly, the egg will not fuse, something will go wrong, and you will not be able to get pregnant. So many couples I've seen who I've told, keep please start meditating and leave the stress of having a child or conceiving or anything that is there in your life. Once you're away from that stress, you will get pregnant, and they do. It's magic. It's magic that they leave all IVF medications, they leave all fertility inducing drugs, they leave everything. Yesterday, one patient came to me. She said, 8, 9 months, I tried for 5 years for IVF, everything I tried for 5 years. I could not conceive. Last 8, 9 months, I just got fed up and I left everything. And I was just chilling and I was just doing nothing. And I actually came out positive, UPT positive. Her pregnancy test was positive, and I wasn't. It's just so beautiful to see that only just removing stress from your life, and that's not only for fertility, guys. That's for everything. That's for a healthy mind. A peaceful mind is important. We in the city is not understanding. In cities, we are not understanding how important it is for us to not take stress. Positive stress, yes, but negative stress that's impacting your health, your mental health, your physical health. You're becoming obese, you're having headaches, your body is showing signs, you're having dryness of eyes, you're having dryness of this, that, you're having itching, you're having chest pains. Your body is telling you, please stop taking that stress. So you have to understand that it doesn't only impact your eggs, your ovaries, your fertility, your overall well-being. Everything will be impacted if you take a lot of stress. So yes, meditation, yoga, breathing exercises, going out, travel as much as you can, travel, go out, have fun, watch movies, read books, whatever. Do painting, singing, dancing, anything that takes away your stress. Please concentrate on that and not just constantly thinking about what is going wrong in your life. Okay. Then again is next thing is risk screening should be done. So genetic abnormalities should be screened, and everything is normal in your body. You should get your regular health checkup done. Obviously, everything is not related to stress. There are a lot of autoimmune problems, genetic problems, general health problems that can happen to you that could be causing infertility or that could be delaying your pregnancy. So you have to get your proper regular health checkup done once in 6 months, once in a year, so that you know everything is in place. Your ultrasound's done. Ultrasound should be done at least a year. So everything you've done, and you know that okay, fine. Theoretically, everything is fine. Then you think about that. What are the other things that can be the reason of my delayed conception, right? Vaccination is just get the regular vaccinations done before pregnancy, so that there are no problems during pregnancy. Okay, so conception is a joint effort requiring both partners to be in a good reproductive health. Definitely, obviously, it's a two-way game. It's not a one-person thing. So both the people should be healthy. Both the people should be in their best of health to actually conceive a healthy baby. Okay, so health checkups checklist for her. So it is firstly you have to get preconception counseling. What I'm doing right now is practically that only. That I'm telling you what are the do's, what are the don'ts, what you should be doing, how you should be doing, have sex in your fertile period, get your regular health checkups done, get your blood tests done. So, what are the blood tests that are very, very important? Firstly, they've mentioned hormonal tests thoda late. So, hormonal tests are very, very important if you're not able to conceive or if you're planning a late pregnancy.
Doctor, you're on mute. Sorry.
HLH, progesterone, AMH. These are very, very important, right? Then is normal health, normal regular health checkup. Everyone gets that done. CBC and vitamin D, B12, which is very, very low in a lot of people. Thyroid is off the chart. So many people are coming up with thyroid dysfunction. And then LFT, KFT, a lot of drinkers are there. So LFT is mostly deranged. So these blood tests, regular checkups, and the hormonal checkup should be done if you're planning a pregnancy. So you how much time you have left in your life and for getting pregnant, and how is it possible, or if there's something really abnormal, we can treat it right away. Then pelvic ultrasound, as I told you, ultrasound once a year is very, very important. It should be done regularly. It should be done by a proper person from a proper place, from a proper doctor. And again, so next is pap smear. Pap smear is to be done for females who are above 30 years of age. Before that, there's hardly any need until there's a very strong history in your family of cervical cancer. Pap smear is to be done once in 3 years. Total thrice in your life, you should do it. And after that, if it's negative, then you don't have to do it. Yeah, it actually tells us, because cervical cancer is the second most common cancer in the world. And if we actually get to know that you have cervical cancer after you're pregnant, it's a major mess. So it's better that you get a pap smear done before you actually plan to conceive. Then STD screening, STI screening, that is sexually transmitted infection screening. Again, nowadays, especially in metropolitan, especially in the corporate world, there are a lot of multiple sexual partners. We all know that. So we have to be very, very careful. Please use protection. If not, then please get your STD screening done, because if you have an STD during or after during pregnancy or delivery, the baby has the risk of having it and the complications of it. So please get an STD screening. That also should be, if you're sexually active, if you have multiple sexual partners, no problem, but please get your STD checkup done every year at least, so that you know that you're any complication free. Then genetic screening. So there are some genetic tests that we do, like HPLC, like there are a lot of tests, complicated names. So we have to do those tests for cystic fibrosis and all, so that because if you are a carrier, like thalassemia, you must have heard that a lot of thalassemia minor patients are there. So in thalassemia, if you're a thalassemia minor, you will never notice anything in the entire life except that you have um, uh, low hemoglobin throughout your life, like a 10, not very low, but 9, 10 hemoglobin. Your hemoglobin doesn't raise after that, above that, and you have that throughout your life. You've never had any problem. You've been living a normal life. That could denote that you are thalassemia minor. So we confirm it with a genetic screening. If you are thalassemia minor, if your partner is also thalassemia minor, the child has a very high probability to be thalassemia major. If the child is thalassemia major, firstly, the child does not have a life beyond 30 years, and they need constant blood transfusion every month. And they have there are a lot of complications that happen. They have stunted growth, a lot of problems, and their life is very small. So you have to get that screening done when you're planning pregnancy. Thalassemia, sickle cell disease, There are certain populations also that we think like African has a different problem in this thing. Indian population, Asian population is different. So we do the genetic screening according to that, but please do get it done when you're planning a pregnancy. Then again, for the males also, say similar preconception counseling. What I'm doing right now, blood tests are similar. You can get testosterone. One very important thing that if a couple is not able to get pregnant is semen analysis. That is, they take the semen sample and they test it for the motility, for the quality, for the any pus cells present, any infection in the sperm. So all these things. Then again, genetic screening is important. Ultrasounds are important, that there's no scrotal swelling or testis swelling or anything like that. And STD screening is equally important for both the people in a couple. Okay, so lifestyle changes again. This is the same thing that I've told you. Please, exercise regularly, manage your weight, eat healthy diet, eat proper diet, eat healthy food, fruits, vegetables, a lot of fiber, whatever antioxidants you can take in whichever form. Please take that. Then if you're planning pregnancy, it's very, very good to avoid alcohol and smoking, because they do increase the free radicals in the body and they will delay your conception for sure. Also, smoking is a major causative factor for PCOD, which is on a major, major rise nowadays, and lifestyle habits and sedentary lifestyle and no exercise, everything is causing problems. So you have to take care of that. Then manage stress with yoga, breathing exercises, as I've told. Avoid any exposure to toxins, which I don't think we can avoid staying in Delhi, especially. And then get adequate sleep. That definitely helps. Definitely, it helps with stress and your body functioning, normal body functioning. Caffeine can be limited if possible. If not, then at least like restricted to 1 or 2 cups a day only. Caffeine does jack up your heart rate a lot, which can result in bigger problems in life. So make sure you know that. So, how do you navigate the fertility challenges? So when do you decide that, first you've done lifestyle changes, you've tried having sex in the fertile period, you've done your medical consults, you've taken ovulation induction drugs, you've done ovarian health supplements, everything you've taken, still it's not happening. Then we go in to find out exactly what is the cause. For 1 year, you've tried everything, it's not happening. Then we go on to find out the cause. So there are a lot of causes for infertility. We have to rule it out one by one. So if by chance there's a problem with semen, so if we get to know कि semen analysis पे से semen की motility, sperm की motility सही नहीं है. So what do we do is we take the sperm, we concentrate it, we take the concentrate and we push it inside through the vagina, we push it inside the uterus. So what happens is we are escaping the sex wala part, we are skipping the sex wala part, which might have a, okay, so infertility, I'm so sorry, I'm interrupting in between like that, but I forgot to mention that there might be sexual problems that a couple has, which they're not addressing or they're not discussing about. It might not be your health per se, but it might be your it might be a sex related problem, that you're not able to have intercourse properly, you're having it wrongly, you're ejaculating too soon, or you're ejaculating outside, or there might be a lot of problems with that. So you have to address that. If you actually have that, discuss within yourself and go to a sex therapist, or go to a psychologist, or go to a gynecologist, or go to a surgeon, anyone you feel, and any doctor can help you with that. So they will guide you accordingly, according to what the problem is, right? So what we do is, coming back to, you've tried everything, the sperm motility is not good. So what we do is we concentrate the sperm and we insert it into the vagina. So we have skipped the sex part. We have done, we've put the sperm inside the uterus. The sperm will go reach the egg and it will fertilize it. That's called intrauterine insemination. It's just literally just injecting the semen inside the uterus instead of the penis doing it, right? So next is, if that doesn't fail, so that also goes on for, we have to try at least for 3 to 4 months. Just once trying में we can't say कि IUI fail हो गया. We have to try for at least 3 to 4 months, and then we say कि अच्छा अगर if that's not failing, then we find out some other cause. Then what the cause is? That the tubes could be blocked. Your tubes could be blocked. You could um, if you have a lot of white discharge, if you have pelvic inflammatory disease, that if you have a lot of pain in your lower abdomen, if you have a lot of white discharge, you could be having abdominal tuberculosis or pelvic inflammatory disease. Extremely common but ignored by a lot of doctors and patients, everyone. So, abdominal tuberculosis is a major infertility cause. If you're having constant abdominal pain, if you're having constant evening rise of temperature, that means in the evenings you feel that you're feeling feverish, or you're feeling unwell, little sick, or you're this thing weak, and you're having constant white discharge, foul smelling, and your periods are extremely painful, please go get it checked for abdominal tuberculosis. They make the tubes stick with each other. There is no space for the fertilization of the egg and the sperm to happen. So that is another cause of IVF infertility. So make sure that you keep in mind, if you go to any IVF specialist, they will definitely check you for tuberculosis, but not every doctor does. So keep sure you remind them. If they don't remember it, you should remind them that please check me for abdominal tuberculosis if you have these symptoms. Then IVF, you all know it's a huge process, it's a long process, it's an expensive process. You have to get a lot of drugs, injections, everything. They pick out the egg, they through an injection, they pick few eggs from the mother, they take the semen, they fuse it outside, they keep the embryo either frozen, or they transplant the embryo immediately. It again, it's a medical procedure. It has its failure rate. Only 60 to 70% are actually successful. 30 to 40% do fail. And so again, then there is, if your egg is completely depleted, your egg is not present, only you are at an age that your eggs are completely finished, then they will ask you to get a donor egg, or they will arrange one donor egg for you, and you still can get pregnant. The only thing is, it will not be your egg, which is not a big deal, because you are getting pregnant. It's nature versus nurture. But if you nurture it, probably it's your child only. So that again happens. And if the sperm, supposing the sperm is not, the quality is not good, the sperm is not, um, uh, the number of sperms is completely depleted, there are not left anymore, then they will take a donor sperm. Similar process. And the last option is adoption. Surrogacy is also coming up now, so you can go in for surrogacy. If surrogacy, I love the adoption idea. If you guys are actually suffering from something really bad, then please, I do promote adoption, so please do go in for that.
Thanks a lot, Dr. Tanvi. So I'll just quickly chime in here and talk a little bit about UV. So hi, I'm Mehek, and I am the founder of UV Health. We started UV 3 years ago with a goal to help women who are dealing with metabolic issues, hormonal issues, and reproductive issues like PCOS, thyroid, and we also focus on fertility. So of course, where we come in is very early part of the chart here, which is when you are actually in the early phases where you're trying lifestyle changes, tracking and timing. Maybe you have some hormonal issues, but you want to give yourself the time to deal with these issues in a natural way by working on your lifestyle. Because as Dr. Tanvi mentioned, there is a lot of influence of how we are leading our life related issues so early on is because of the kind of lifestyles that we are leading. So what we do at UV is we give you a comprehensive support system around your lifestyle management. We have a dedicated app for this and a dedicated team for this. So it is a very personalized program, and you can actually check out our app later on just to get a sense of our solution. What a typical journey of someone would be in our program is actually you will be attending a lot of live yoga for fertility sessions. We focus on yoga because it helps a lot with stress management as well. along with healing hormonal imbalances, promoting blood circulation in your reproductive organs. And we've seen where people with hormonal issues have practiced this regularly and seen changes in themselves, very sustained changes, even including weight loss. And then you also get mapped to a personal nutritionist who will understand everything and understand what are the gaps in your diet, what are you doing wrong, right, and what needs to be adjusted. Again, as Dr. Tanvi mentioned, you need to have a very nutrient rich diet during this period, because your body is going to nurture the baby inside you. So we need to ensure that you're having all sorts of your macros are good, your micronutrients intake is good, and if you have any deficiencies, that you address those right in time, so that there are no challenges later on. We have a very thriving support community of women who are trying to conceive, right? So this is a place where you can share your journey, talk about your challenges, show your progress, and stay motivated. And lots more. We have ovulation tracking, daily challenges, and a lot of other support system that we provide in the program. So just to give you a very brief, right, we have 3-month and 6-month programs where you get unlimited live yoga access. You get a personal nutritionist, a fertility focused diet plan that you can get every alternate week, changed as per your liking. You can track your ovulation in our app. And in the 6-month plan, you also can consult a doctor and seek mental health support if you need that, as well as we provide lab testing at home. So if you're looking to start and you're early in that process where you're looking to get a comprehensive fertility test done, then all of that is something that we provide. And we do have a special offer for people who are attending this webinar and who are the members of NOVA. So you can note down this code, and we'll also share the link in chat on how to find more information about our programs. Feel free to go to our website and set up just a pre-consultation to explore more and talk to one of our experts. We'd love to now open it up back to Dr. Tanvi and opening it up to the audience for any questions. Yeah. You can share your questions in chat, or you could also directly ask however you feel comfortable. It is a safe space, so there is no need to worry. Yeah.
Yes. Okay. So first I'll answer the question. DNC can lead to infertility because if DNC is not done properly, and so what is DNC? Basically, you're curating. You're curating the inner lining of the uterus to remove the pregnancy, right? Or anything, any reason if you've got DNC done, it's basically curating the inner lining. So the inner lining is very, very important for the implantation of the pregnancy. The baby gets implanted on that lining only, so that lining is not healthy. Also, what happens is if you're doing it very roughly, so what happens is the uterus actually collapses and it goes and sticks to itself. Like it goes, the anterior wall and the posterior wall of the uterus, it gets stuck. So there's no place for the pregnancy to happen. It gets stuck very badly. It's called Asherman syndrome. So yes, DNC can lead to infertility. I think the other question was, if you have a low AMH, then can you get pregnant? Uh, Depends how low. If it's like 0.03, 0.04, then very, very less chance, because AMH basically shows that what is your ovarian reserve. Ovarian reserve means how many eggs you're left with, how what kind of quality of eggs you're left with. So if AMH is very, very low, less than 0.5, less than 0.6, less than 1 also, there is a low probability, but definitely there are medicines that come to improve the quality of the egg. We can't increase the number of the eggs, but we can definitely improve the quality of the eggs left. And we can pick out, in IVF, we can just pick out the healthy eggs and we can get you pregnant.
I can ask a question if anybody wants to send it. They can send me privately as well if they're not okay. putting the question at the public.
There's no medication.
Yes. Any other
Okay, so
question?
if you're having, so yeah, I think there is. So if you're having a lot of um, you're having a lot of vomiting during the first 3 months. No, little bit vomiting is normal, but if you're having a lot of vomiting during your first 3 months, there's a tablet called Doxinate 24, Doxinate, Doxinate 24. That will actually help you with the vomiting. And if it doesn't help, then there is another medication called Perinom, but I don't think I should be prescribing medicines here. If possible, please see your gynecologist and tell her, because she has to. Vomiting has to be stopped, because if you're vomiting constantly, it will harm the baby a lot. So you need to stop the stop the vomiting at any cost.
I'll take up the questions from the chat. Can we get the presentation? We'll be uploading this video on the YouTube channel. You can just check it out there, so you'll be able to have that. Any chances to increase the AMH level?
No, very less chances. We do have tablets like AMH Fix and Overbless and everything that actually do increase. I have seen a little bit of increase, but not a drastic increase. Little bit, yes, possible, but not a drastic one.
Can endometriosis affect fertility?
Oh, 100%. Endometriosis. What is endometriosis? Endometriosis is when your uterus, instead of bleeding outside, the periods happening outside the body and coming outside through the vagina, it's going through the tubes into the abdomen. So your basically there are endometriotic patches in your abdomen that are formed, and they start bleeding every month. As you bleed outside, they will bleed inside also. And when you bleed inside, it will cause everything in your abdomen to stick with each other. The intestines will stick to the uterus will stick to the tubes will stick to the bladder, everything will stick to each other, and that will disrupt the normal anatomy of the abdomen. And as a result, probably the egg will not be able to release from the ovary if it's ovarian endometriosis. And even if it's there, the tube will not be able to pick up, because it's stuck somewhere where it should be a free flowing structure. If it's stuck somewhere, it can't pick up the egg only. Endometriosis will 100% affect. It causes infertility for sure.
Can you suggest diet changes for women to get pregnant?
Diet changes for women to get pregnant. See, I told you already that please eat healthy, avoid carbohydrates as much as possible, generally in your life, not only to get pregnant. Generally, avoid carbohydrates, they're not very good. Avoid sugars, avoid aerated drinks, avoid any kind of junk food, avoid red meat. Eat a lot of vegetables, eat a lot of fruits, eat a lot of fiber, eat homemade food as much as possible, and eat a lot of proteins. Proteins will always help you go the long way. Not the protein powder. No, no. Please don't rely on protein powders in your life. Take proteins in the form of paneer or soya or chicken, fish, whatever form, sprouts, avocados, chia seeds, whatever you can take it in the form of. Please take that.
Next question. While ejaculating, does the position of the women affect the chances of pregnancy? If yes, is there anything that needs to be done to increase the chances?
So, if you're ejaculating inside the vagina, it could be any position, it doesn't matter. If you're ejaculating inside the vagina, the sperm will manage its way up into the uterus. So you don't have to think, "Ki, acha, ulta latka do, ye kar do," nothing like that. You don't have to think about all that. Even if the woman is on top, any which way, it doesn't matter. If you're ejaculating inside the uterus, the sperm will find its way if everything is normal.
Okay. Do masturbation affect the fertility in males in future?
Yes, it does. Too much masturbation does, because you're constantly getting rid of the sperm. Although the sperm is continuously produced in your body, it's not something that you're born with a fixed amount or something like that. But if you're masturbating too much, it will decrease the quality of the sperms, definitely, because that means that the testosterone is really getting released too much, and it will cause other problems in the sperm.
I have PCOD. Without tablets, I'm not getting periods. Then what do I do to cure it?
Okay, so if you're not getting, you need to get a hormonal profile done, proper full hormonal profile done. That is FSH, LH, prolactin, TSH, fasting insulin, testosterone levels on the second day of your periods. It's called a PCOD profile. If you go to any lab, they will do it, but get it done on the second day of the cycle. And please visit a gynecologist with the test reports. Also get the ultrasound done, and you have to take a course of like 6-7 months or probably a year to actually normalize your periods, and you have to this thing. Also, the reason that you're not getting your periods could be raised prolactin, it could be a tumor in your brain that is causing that, or it could be very low AMH, that is you're getting premature menopause. It could be a lot of things. So if you're not getting periods without tablets, you have to address it immediately.
We'll take up two more questions and we'll try to end the
Yeah.
session.
Yeah.
What is the egg rupture size?
So egg usually gets ruptured around 18 to 22 mm. So that is the time, that is the usually around the 14th 15th day of your cycle. That's when we say कि वो follicle rupture करता है, egg नहीं rupture करता, follicle rupture करता है, and egg को release करता है, and egg goes into the release out of the ovary, and it is picked up by the tube. It's around 18 to 20 mm.
Okay. Is there a way to increase the sperm count?
Sperm count, yes, definitely. There are a lot of medications that you can take. You can take antioxidants that really coenzyme Q, astaxanthin, L-carnitine. There are a lot of supplements that really help increase the sperm count, and it also exercising, eating proper diet. All of this will increase the sperm count, and taking
Just
less
last.
stress. I can't focus more.
Do you have any questions in your private? Direct as a direct message? Or I'll just take
No.
out the last question.
No, I don't think so. I have it.
Okay.
I can't see.
How long should we stay without washing after sex?
Ideally, for your for preventing UTIs and preventing vaginal infections, you have to clean the area before and after sex immediately. Even if you're planning for pregnancy, more than 5 to 10 minutes, you don't have to wait. Then you can wash out easily. There's no problem, because again, I told you, once the sperm has gone inside the vagina, it will find its way up to the sperm, up to the uterus. You don't have to think कि अच्छा, if I don't wash or if I don't do this, then it will go, or for 1 hour keep lying in that position. Nothing like that. It will just lead to vaginal infections.
Okay. All right. I think we're done with the questions. We'll also have, so in case you have more questions,
So there's one more question. There's one more question. I would like to answer that. So pain during intercourse is normal. How can you stop feeling pain during intercourse? So pain during intercourse is absolutely not normal. It could be a lot of problems. It could be vaginismus. Vaginismus is a problem where you actually contract your muscles with the fear of having sex, and you don't let penetration happen. Then again, it could be endometriosis. Pain during intercourse is one of the symptoms of endometriosis also. That means that everything inside is stuck so badly that anything that moves will give you pain. Or it could be severe vaginal infection. It could be a lot of things. Pain during intercourse is absolutely not normal. Little bit just before insertion, yeah, fine. But after insertion, if you're if you're well lubricated and everything, it should not be painful at all.
Yeah, great. I think that's the end of our Q&A as well. Thank you so much, Dr. Tanvi, for having being with us and doing the session for us. I know there might be a lot more questions. Doctors will be available for you. You do have a link where you can have a free consultations as well with UV Health, and you also do have a coupon code to understand more about fertility, preconception, and how do you further take it up from here. I know this is like a basic session just to give you an idea about what is the first step that you have to take, but there's a lot more step, and obviously a lot of patience also is involved in this entire process as well. Right. So you do have a doctor and a consultant that will be available for you via UV Health. And Dr. Tanvi, I can't thank enough for you to be here and take the session for us. Thank you so much again for taking out time within your busy schedule. And thank you everybody for joining this session. Yeah, please. Thank you. Thank you, everybody.